Miss Forbes, if you're hearing, can you put out a blast on all the groups again? Miss Forbes, can you give me a thumbs up to let me know you heard?
Good evening, everyone. Thank you so much for joining. We're just going to give some more persons an opportunity to join on, and then we'll try to get started by 6:10 the latest. So that's like 2 minutes time. So if you know somebody that's interested in logging on, you could ask them to hop on as soon as possible. That would be great. All right. Hi again, everyone. Thank you so much for taking the time to be here with us at Ask the Expert. Um, I'm just going to provide you just with a little bit of background information about the Lupus Foundation of Jamaica. It is an organization that has been transforming lives and building hope for over 40 years. And the foundation is really volunteer driven. It's a member supported organization dedicated to improving the lives of persons. Hold on 1 minute there. Right. Okay. There, I think you can see me there. Right. It's a little bit better. Right, awesome. So as I was saying, the foundation is a volunteer-driven organization. It's member supported, and it's basically dedicated to improving the lives of persons affected by lupus through education, advocacy, and support. Right, and as we know, many persons may know lupus is a serious autoimmune disease, and it affects thousands of Jamaicans, and it can be life-threatening if it is not um, managed properly, right? So the foundation is here to make an impact, and it really creates a strong sense of community and practical support, right? So benefits of persons being a part of the foundation is that you can receive professional counseling services. We have discounts through a pharmacy program, as well as we assist with medical expenses. We also have a monthly support group meeting for persons who are interested. There's also a WhatsApp support network where we're all in a group together and persons are able to speak freely or connect with somebody else who may be experiencing probably a similar symptom that they may be experiencing, right? And there's also opportunity to participate in awareness events and different outreach activities. So we are encouraging anyone who is online who is interested in becoming whether a volunteer or if you're a lupus warrior yourself, then feel free to join the foundation. Well, you can, sorry, hold on there, multitasking. So you can become a part of the foundation by visiting the website Lupus Foundation of Jamaica .com. There you can be actually pay to become a member, and the fee is $1,000 for individuals. Um, if you also have any questions or queries, you can also reach out to us. I will put the WhatsApp number in the chat. Shortly, I'll look for it and put it in the chat so you can reach out to us via WhatsApp as well. And it's just important for you to know that becoming a part of this organization, you can, whether through being a volunteer or if you're a warrior yourself, you can make an impact, right? If you're a volunteer, you can make an impact on somebody else's life. And if you're a warrior, best believe that you can make an impact on somebody else's life because something that you have been through, you can share your wealth of knowledge to somebody who just learned that, who just have been diagnosed. So we just want to once again encourage you because in any way, shape, or form that you can give your support, it will be appreciated. So I'm going to hand over. Well, I will, as I said, I'll put the WhatsApp number in the chat, and I'll now hand over to Dr. Lo Jones for the introduction of our speaker. Welcome again, and I hope you enjoyed the session.
Thank you so much, Miss Stewart, for that wonderful introduction and letting our members know the importance of the Lupus Foundation of Jamaica and what it can do for our members. And hopefully, after this evening, we will recruit some new members. Because at the end of the day, we're all a family, we're all lupus warriors, we're all supporters to really, dive through this disease that we know can affect all over the body. However, tonight, we are going to hone in on lupus and the kidney. Actually, World Kidney Day just passed, March 12th of this year, and it is an annual public awareness event that is held internationally, educating the public and other persons in the healthcare field, the high priority of kidney disease in patients and the silent nature of kidney disease. And unfortunately, lupus is one of those diseases where the kidney attacks and can wreak havoc and cause kidney failure. So actually, every year there's a new theme, and the theme this year is kidney health for all, protecting the planet. So it takes on a more environmental theme this year. So we're going to talk a little bit about everything, a little bit about lupus, a little bit about the kidneys, and of course, some of the impacts that we can see on the environment in persons with kidney disease. I have the great pleasure of introducing our guest speaker tonight in our quarterly Ask the Expert series. And she is Dr. Tanya Reed. She is a senior registrar at the Cornwall Regional Hospital. She completed her formative studies at the Montego Bay Community College, thereafter pursuing her undergraduate studies at the University of the West Indies. She later advanced her medical career by completing a doctorate of medicine in internal medicine, which she completed in 2024. Dr. Tanya Reed is really dedicated to delivering high quality care especially in underdeserved communities in rural Jamaica. So looking ahead, Dr. Reed's vision is to become actually a nephrologist, and we're so happy to hear that. So not one that not only provides world-class renal care, but also redefines how this specialty is delivered in Jamaica. There are about 10 nephrologists throughout Jamaica that takes care of adults. And we have about 3 pediatric nephrologists in Jamaica. And so we're looking forward to Dr. Reed completing and pursuing further studies to become a consultant nephrologist. So her interest in nephrology is rooted in the immense impact that kidney disease has had on individuals and families, especially in resource-limited settings where prevention and early intervention are often overlooked. So she aspires to bridge this gap by combining evidence-based medicine with a strong focus on accessibility of kidney care for all. And with that, I'd like to pass the mic to Dr. Tanya Reed to begin tonight's proceedings. After Dr. Reed gives her talk, we're going to have a very open discussion, and we encourage our members to ask as many questions as they want about lupus, about the kidney. And so we want it to be a more relaxed environment. So over to you, Dr. Reed.
Hi, evening. Thank you for inviting me, Dr. Lojo.
You're welcome.
Is everyone seeing my screen?
No,
Yes,
not
we are.
as yet.
Yes,
Oh,
we
yes,
are.
yes.
All right, great. So to celebrate Renal Week, I would like to, just a second. All right, so basically I would like to talk about the importance of the kidney, what is lupus and how lupus affects the kidneys, how the environment itself affects persons living with kidney disease and lupus, and any preventative measures that we can explore. All right, so I want to talk briefly about the function of the kidney. So your own kidney is basically a natural detoxifier. It is a highly complex, pardon me? Oh, okay. It's a highly complex organ. It controls many substances in the blood. It regulates blood pressure, essentially controls our blood pressure. And it basically controls the amount of fluid in the body. It essentially, the purpose of it is to ensure that the blood is clean and everything is balanced. It serves as a filter, and the purpose of it is to get rid of waste and to return vitamins, amino acids, glucose, and hormones into the bloodstream. Now, there are other functions of the kidney. The main job, as I said, is to filter the blood and to remove the products. But it also serves to maintain the water that we have in a constant balance. It also is important that for secreting several essential hormones, as I said previously, and it also serves the purpose to stimulate the bone marrow, to make our red blood cells. It actually activates vitamin D as well that we get from our diets and from the sunlight so that we can maintain healthy bones and teeth. So what happens when the kidney can't do its job? Now, essentially, when the kidneys don't work, waste products will build up in the body. If that happens, then sooner or later, you'll feel sick. Eventually, you may end up you may end up dying, and that's what we aim to prevent. So there are many stages of kidney disease. Not every person with kidney disease will have the same level. Kidney disease ranges from stage 1 to 5. Depending on the level that you are, we go about this by we do a blood test to determine the stage of kidney disease that you have. What I want for you to take away from this slide is that thereabout when you are at a stage 3, essentially, we do the blood test, we check by doing a kidney function test, and we're able to calculate what your kidney function level is at. From there, we will start testing or put plans in place to prepare you just in case you are in need of dialysis. Because we do not want for you to reach end stage, which is essentially when the kidney function falls to 15% or more, or less, sorry. So what happens, or how do you know that a patient may have symptoms? So one may present with extreme tiredness and fatigue. They may present with nausea and vomiting. And this vomiting can be in the case of, they can be vomiting blood, which is manifested as dark or very black substances. They can be complaining of tiredness or confusion. They have generalized weakness, and the weakness is particularly around the face, the feet, the abdomen. They can have reduction in the amount of urine that is produced. You can also have muscle cramps. You also have dry and itchy skin. And a lot of times, particularly in the lupus patients, they may present with even foamy urine. Now, sorry. There are many things that may increase your risk of that may increase your risk of kidney disease. And these risk factors are, you have diabetes, or what we call what you may know it as sugar. You have high blood pressure. You have heart conditions, smoking. There's also persons that have an increased risk of, a lot of patients take pain meds, and these pain meds are particularly your Advil, your Cataflam, your ibuprofen, and you have persons that are increased risk of infections, and persons as well with the medical condition that we're about to talk about a little, lupus. So I want to talk about lupus, and many persons may know what lupus is, many may not, but I'll take the time out just to explore just a little bit. Now, lupus is considered a long-term condition, what we call a chronic disease. It causes inflammation and pain in all parts of the body. It commonly affects organs such as the skin, the joints, the heart, and the kidneys. Now, it is essentially an autoimmune condition, and what we mean by autoimmune is that there's a widespread inflammation of all the tissues. The healthy tissues are fighting against the cells in your body. And I like to take the example of everybody was affected by COVID in one way or other. They introduced the COVID vaccine. So the purpose of the when everybody gets COVID, or even if you never had COVID before, the purpose of the COVID vaccine is essentially when you are vaccinated, or anybody that is vaccinated in Jamaica, the purpose of the vaccine is to produce what we call memory proteins. So memory proteins are what are known as antibodies. So in a normal system, you're supposed to produce antibodies against viruses, for example, the COVID virus. But in a condition like lupus, you are producing these memory proteins against your healthy tissues. And as a result of that, you are causing widespread inflammation just about in any organ that you can think of in your body. Essentially, it will lead to damages to the kidney, damages to the heart, damages to the skin, and most times what you will end up seeing us with the symptoms that I alluded to before. The vomiting, you might have proteins in the urine, some people might have blood in the urine, they might be complaining of swelling, etc. Now, how is lupus in itself diagnosed? Again, I said we have a series of, we can start by doing a blood test. So when you come to the doctor, we generally do a blood test. What we check for is we check what is called your urine and electrolytes. We send it to the lab, and from it, we're able to check if your renal function or your kidney function is normal. In addition to that, we also send the urine itself to the lab. We can check if there are red cells in the urine, and we can check if there are proteins in the urine. If you have proteins in the urine, again, clinically, when you look in the bowl, you're actually looking for a very foamy urine, right? We also can quantify the amount of protein that you are actually losing. So we send it to the lab and we actually say, for example, you're losing 100 protein or you're losing 500 protein. And that has clinical significance for a patient that has lupus. And ultimately, the diagnosis is done by what is a biopsy. And that's where they use ultrasound guidance and they basically use a needle, take a small piece of it, they send it to the lab for testing because this determines the type of kidney disease that you have with lupus and therefore determines the treatment that we will do. So this slide is essentially how we manage a patient with lupus and by extension lupus nephritis. What I want to point out, as I said, there are different stages of lupus and lupus nephritis. There are essentially 6 stages. However, what I want to point out is that every patient that has lupus must be on a medication called hydroxychloroquine. This is a medication that is commonly used for patients that has malaria, but it has many functions for the patient that has lupus. One, it prevents or minimizes your risk of flares. That's one. Two, it actually has wonderful benefits. It minimizes the skin. It has many benefits to the skin. So it's actually protective in terms of the skin. Two, or three in this case, it actually minimizes your lipid levels. And a lot of the patients with lupus, they tend to have high cholesterol levels. It also minimizes your risk for forming clots. Clots can form anywhere from your clots in the leg, clots in the lung, and any clot or any flare increases your risk of death. So essentially, hydroxychloroquine is a very good drug for any patient and every patient that has lupus. So if you're not on hydroxychloroquine, if there's a reason that you can take it or you must be on it. That's basically it. It's important to note as well that we have other medications specifically for patients with lupus and lupus nephritis. And one common drug or the other drug that we use is MMF. And we might use other drugs, for example, biologics as well. What I want to highlight is that we aim, one, as I said before, a kidney biopsy is very important. It remains what we use to diagnose lupus nephritis. If the diagnosis is uncertain or persons had a diagnosis before, but something has changed, then we may need to repeat the biopsy at some point. We aim to reduce the patient's the protein that they're losing in their urine by at least 25% in the first 3 months. And we go about doing that by giving medications to minimize the inflammation in the kidneys. So these are what we call immunosuppressants, because as I said before, lupus is a chronic inflammatory condition that affects the kidney, right? So we have to give you something that will minimize the inflammation or suppress the immune system from attacking the cells in the kidneys in this particular case. So one, most patients, they are ideally started on prednisone or a pulse dose, what we call a very high dose of prednisone. Two, they're given the MMF and the other medications, such as your biologics. But what I want to point out that there are other non-immune treatment that is used for patients with lupus and lupus nephritis. And what is important is that one, the amount of salt that is contained daily is very important. And it's important that you're consuming less than 5 grams per day. It is important as well that the blood pressures are controlled because one, as I said, the kidneys are not, one of the main functions of the kidney is to regulate the blood pressure. And if the kidney is not working, then naturally the kidney is unable to regulate the blood pressure or maintain the blood pressure at this point. So we have to control the blood pressure. And one of the drugs that one, reduces blood pressure and two, helps to reduce the amount of protein that you're losing from the kidney are what we call ACE inhibitors or ARBs. A lot of you may know these drugs. They start or they end, sorry, with sartan. So you might have losartan, telmisartan, valsartan, or many of you may know it as Resilo. Resilo is also called losartan. Then there is the ones that end with pril. So for example, you have enalapril. So unless you are unable to take these drugs, again, hydroxychloroquine must. And we also put you on a blood pressure medication, one, to control the blood pressure, two, to minimize the amount of proteins that you are losing. If we are unable to achieve the protein that you're losing, so when you go to the doctor, it is important that at your follow-up, whether it be on a 3-monthly or a 4-monthly basis, that they are quantifying the amount of protein that you are losing. So this is a blood test that we normally send, sorry, not a blood test, a urine test that we normally send to the lab. When we send this urine test to the lab, it is, for example, it can tell you if you're losing 500 milligrams of protein or 100 milligrams of protein. At the end of the day, we want you to have as minimal protein loss as possible. So if you come to the doctor now and you had 1,000 milligrams of protein and you are on Resilo, for example, and in the next 6 months, you have 1,500 milligrams of proteins in the urine, you are very much taking your medication, then your risk of kidney progression and end-stage renal disease increases. Therefore, we have add-on therapies that are non-immune, meaning it serves no purpose in terms of suppressing the immune system. And that's where what we call the SGLT2 inhibitors. So you guys may know it as Forxiga or Jardiance. These drugs are very good. They're add-on therapies that we also use in conjunction with the regular blood pressure medications to help us in terms of reducing the protein. It's also important that your cholesterol is under control. Again, most of our lupus patients, definitely lupus nephritis patients, are usually placed on cholesterol tablets. One, you guys have an increased risk of heart conditions, heart attack, and you have an increased risk of stroke as well. So, and your cholesterol are naturally more elevated than other people. So we do ensure that you are on cholesterol tablets. Keep in mind as well that vaccination is very important. So you need to keep up to date with, for example, your yearly flu vaccine, for example, your COVID vaccines. And remember that bone health is important. Why is bone health important? A lot of persons may be on long-term steroids like prednisone for a very long time. Prednisone, causes effects to your bones, quote unquote. It can rotten the bones, make them very soft, make them very brittle. So remember your calcium supplements, your omega-3, fish oil, etc. as add-on therapy for your management of your lupus and your lupus nephritis. All right. Now, there are other factors that can affect patients with kidney disease and lupus. Namely, you have environmental factors, you have infectious etiologies, and you have medications. Now, I want to talk just a little bit about how the environment can affect our kidneys. And I want to take the time out to, I guess, highlight how Melissa has impacted us. Many of us in more way or form were severely impacted by Melissa last October. What it actually did was it led to severe loss of housing, loss of trees and vegetation. They had catastrophic flooding. We had inability to obtain clean water. There was no light, and a lot of people lost their house and by extension roofs, right? This led to an increased cases of leptospirosis. So that's an infection that you get from the urine from rodents. You can get from other organisms or other animals, but more commonly a rodent. And then you have an increased case of mosquito-borne illnesses such as dengue. We also had an increased case of the diarrheal illnesses. So a lot of persons were coming in with gastroenteritis. And then we cannot forget lockjaw. That's when you may have stepped on something that is contaminated, and persons may present with stiffening of the body essentially after a few days. Now, I want to highlight that there are ways in which we can prevent these things, having been exposed to these parameters, because if we do not prevent, what can happen is that there's a sequelae of events. If, for example, you have dengue, if you have lepto, or any gastroenteritis, then you essentially become dehydrated. Dehydration may lead to effects on the kidneys because you're losing all of this fluid. From the lepto itself or otherwise, you can end up with liver problems. You can also cause a breakdown of a muscle enzyme that can cause severe toxic effects to the kidneys called rhabdo. So these are ways in which all these infections can affect the kidney in one way or the other. So there are many preventative measures that we can explore so as to reduce the risk of kidney injury and by extension, death, right? And one of them is ensuring that the water that we consume is safe for consumption. So you need to boil the water. If you're unable to boil it, then I'm suggesting that you put at least 8 drops of bleach. Ensure that all the water is stored in a container that is actually covered, and be careful where the water that you actually consume is coming from. So be careful of any rivers or any unsecured sources as well. Again, be careful of mosquito-borne sites. If you're going to use a mosquito repellent, that must contain DEET. Be sure that you use mosquito nets. And if you have any containers that are, loose around the house, any flower pots, etc., be sure to remove the water that is lying around because this is a breeding site for mosquitoes. Now, a lot of persons underestimate the fact that the water that we do not consume or the water that we should consume is not important. Dehydration is actually one of the most common causes of kidney injury, as I said before. Dehydration can be in the form of many ways. Either you're vomiting, either you're having diarrhea, or simply because you're just not consuming enough water, given the fact that we don't have enough, and 2, given the climate that we live in. So it is recommended that you drink at least 8 glasses per day. And if the time is excessively hot or you're sweating excessively, then you might want to drink an additional to ensure that you're keeping hydrated. Remember that you can also get it from your fruits, for example, your watermelon, sometimes even a banana, but be very careful. That can be a little bit tricky because banana is very high in potassium, and that may pose some problems in persons with underlying kidney problems. Now, there are also drugs that are very toxic to the kidneys, and I wanted to point out, 3 important ones. Again, I made mention before NSAIDs. What are these NSAIDs? So a lot of patients, particularly when they have lupus, they commonly have joint pains. I want to make note that you should stay away from drugs, especially if you have kidney problems, such as Advil, Cataflam, ibuprofen. Drugs that are actually safe, it could be Panadol. Panadol is quite safe. And if Panadol does not do the job, then you can do something like Panadine or Panadine F or even Tramadol. I know a lot of times you may have an underlying infection. A lot of patients sometimes may have an underlying urinary tract infection. And the importance is a lot of these antibiotics, one, they may be toxic to the kidney if they're not adjusted to match your kidney levels. Persons that are actually on immunosuppressants, for example, even the common
So I'm
drug.
not in charge. I'm so sorry. The pan 13%.
Some of the patients that are on immunosuppressants, even our patients that have rheumatoid arthritis, for example, on methotrexate, that can be toxic to the kidney. Even our patients the same patients that we give with the lupus nephritis, some of the drugs, for example, tacrolimus, those drugs can be deemed toxic to the kidney. So it is important that even if you're on those drugs, we have to check the levels to ensure that they remain within the safe dose. Again, I emphasize that follow-up with your doctor is important because that's the only way we can tell by checking if those drugs are actually within the safe level. So what I want to point out, what I want to point out is that lupus is a multisystemic illness. It is associated with a strong risk of kidney disease. Early detection of lupus nephritis may prevent end-stage renal disease. It is very important that we have good hygienic practices and that we employ environmental protective strategies to prevent other kidney-related diseases, especially in patients with lupus. And at the end of the day, we must avoid all nephrotoxic drugs. Thank you.
Thank you. Thank you very much, Dr. Reed, for a nice summary of kidney disease, tying it into lupus and tying it into the theme this year with the environment. So at this time, we'd love to open up the mic to our lupus warriors to field if they have any questions, concerns, or anything they want to get off their chest. If any of you are taking any of these medications that Dr. Reed mentioned, how are they making you feel? Have you noticed any changes in your urine? So you can open your mic. So there's a question in the chat. Could you remind us of the pain medications that are toxic to the kidney? From Miss Sanko Valentine.
Sure. So the common pain meds are what we call NSAIDs. They're basically non-steroidal anti-inflammatories. So Advil, Cataflam, ibuprofen, Voltaren, just to name a few, those are the common ones that you might take that may be deemed meloxicam to a point, Baralgin as well. So those are the ones that are toxic, sorry. So if you have underlying kidney disease, then do not take those medications. As I said, Panadol, Panadine F, Tramadol are drugs that we would recommend instead.
Thank you. We have a hand raised. Miss Claudette, can you unmute your mic and ask your question?
Yes. Good evening, doctor. You spoke a bit about the meds and some other things that's not good for the kidney. But what about the food that we would normally think is good for our bodies, but yet can be a danger to our kidney if we have any kidney involvement as lupus patients? Are there any foods that we should stay away from?
All right. Generally, as I said before, the aim is to consume foods that are low in salt. Essentially, if you are diabetic as well, you want to have foods that are, I guess, low in carbs, or you're trying to maintain a balanced diet. What is significant, or what we tend to do, is as patients progress to the point where they're on end stage, so not necessarily applicable to you, but the ones that reaches end stage, and that's essentially a kidney function that is 15% or less, or persons that have been established on dialysis, or depending on when we check the kidney function, we will do the kidney function test and we may check, for example, the potassium level, their phosphorus level, etc. So a lot of times when persons are on dialysis, that's when the dietary restriction comes in. And it depends on the type of dialysis as well, because the time between dialysis becomes a little bit trickier when you're on the blood dialysis, which is called hemodialysis. So food that are high in potassium, for example, ripe bananas are excessively high in potassium, or food that you want to avoid, ripe bananas, your coconut water, etc. You also want to avoid foods that are very high in phosphorus. So what we tend to do is we can give you a referral to see a dietitian. One, they can help you. And two, they will help you with a diet plan and then you can simply go online, to be honest, and look up the foods. But you commonly avoid things that are high in potassium, high in phosphorus, because those are the things that will affect you as the kidney damage progress. Your ability to clear your potassium will be impaired, and your ability to clear the phosphorus from your body will be impaired. So we tend to avoid those things while we put you on medications to try and reduce the levels, because a high potassium level can actually cause your heart to stop and you can die.
Thank you for
Okay,
that.
thank you.
Thank you for that, Dr. Reed. And I want to add to what Dr. Reed says, that we really have to avoid these highly processed foods as well. The very high processed foods, sometimes they're gotten from cans, sausages, things with a lot of sodium nitrite. So we really encourage you to read your labels. And many times, most of the foods that you shop in the supermarket, it has a nutritional label, and you'll see the amount of salt, you'll see the amount of potassium, you'll see the amount of sugar, what you call carbohydrate. And so this will allow you to make better food choices. Secondly, I also want to add to what Dr. Reed said about herbal medications or herbal preparations. Now, we being in Jamaica, we do culturally consume herbal preparations, whether it's bush teas, bush tonic, bush medicine. And so we have to realize that what we see and hear out there that says this is a good bush to cleanse your blood, to clean your blood, to flush your kidneys. So this is some of the terminology that is used out there. And I bring caution to some of these herbal preparations in persons who have impaired kidney function. So you don't have to be a dialysis patient to having impaired kidney function, right? Remember that kidney disease is silent. So many of these herbal preparations, depending on how strong you draw it, can be damaging to the kidney. A case in point, dandelion. So I've had 3 patients who went into kidney failure from drinking dandelion tea. And now dandelion was notoriously used for children to help them with bedwetting. And it's also said to be a kidney cleanser. So I just want to bring light to those patients and our lupus warriors out there, that caution with multiple herbal preparation and caution in mixing multiple herbal remedies, because those too can be toxic to the kidney. Any further questions out there? Any questions from our YouTube viewers? We do have a live stream going on YouTube.
There's a question in the chat.
There is a question in the chat. All right, so it says, somebody's asking, or somebody's stating, I was diagnosed with fibromyalgia 1 year after being diagnosed with lupus. I have been prescribed a few different pain medications, but none seem to work. Miss Yolanda, so are you asking I'm assuming that from that statement that she is asking for some advice. Dr. Reed, do you have any advice?
Okay. Well, with fibromyalgia and lupus, a lot of times controlling the factors, because lupus in itself is a very stressful environment, or the condition itself is very stressful. So what I like to encourage patients is one, separate and apart from the medication, have you tried, for example, exercise or any form of therapy? Because some of the times it's not necessarily the medication, but I guess the how do you cope with the condition per se? Like how has this affected you and how do you deal with it? So I guess this is where the lupus support group is very important. I guess it's also important to know what medications patient is on and what other factors are contributing to the pain, if you understand what I'm trying to say. I guess that would be important, but I would explore exercise and maybe, I guess, talking to others. That's the only other thing that I could add to it to try and, I guess, improve the patient's overall well-being, because health is not only about medication. At the end of the day, it has to be about everything. And the social well-being of a patient is as important as well.
Thank you for that. And I also want to add, as Dr. Reed said, pain tablets is not the only remedy for pain. Remember, there are other topical treatments. There's massage. There is different therapies, meditation, yoga. So remember to combine other aspects of pain management into your routine for alleviating pain. And of course, if there are tablets that you're on that is not relieving the pain, you really have to sit down with your doctor and do what we call a medication reconciliation. Go through the medications, and if those tablets are not helping you, there's also an upward step, meaning there are more stronger pain tablets that are available. And so that should be discussed with your doctor. And if that is not the case, then your physician can refer you to a pain specialist to get a more precise and personalized pain care management. We have another question in the chat. Are there ongoing clinical trials that could lead to better treatment or even a cure for lupus? That's from our nurse, Pomegranate, one of our nephrology nurses.
Well, the last guideline was published in 2025. So what that's the last one, that's what EULAR published. And essentially, what we are at now is we have bypassed just using MMF and, for example, the DMARDs like MMF, azathioprine, etc. We have now reached a point where we are on biologics essentially. So we call it the triple therapy. So if patients are, for example, all patients must be on ACE or ARB with your hydroxychloroquine. But with that, they should be on MMF or a calcineurin inhibitor, such as tacrolimus, or they're on a biologic. So that is where medicine has taken us. So for those who can afford, if it's a case where they are refractory, then we have reached the point where some patients may even go to as far as rituximab, depending on their level of control and affordability, etc. But that is where we're at. So gone are the days when patients are just on hydroxychloroquine only or MMF only. We have now introduced biologics into or that is actually what we want patients on, or a calcineurin inhibitor.
All right, great. Thank you for that. And just to add to that, there are It's been very exciting in the world of lupus and kidney disease because not just the rheumatology guidelines came out, but we also have kidney specific lupus guidelines that came out from our guideline central called KIDIGO. And those were published in 2024. It's a clinical practice guideline to manage patients specifically with lupus affecting the kidney. And as Dr. Reed said, there are multiple new agents that are available. Some of you may know rituximab, but we have other exciting drugs out there, belimumab and voclosporin, and some other higher biologics. And we're hoping that the government can really support and subsidize these biologics because at the end of the day, you know, prednisone is one of those medications that is, although it helps with inflammation, but it causes a lot of side effects and many patients don't like to be on it. There's another question in the chat here. Is star fruit one of those foods we should avoid? I have a big, my camera on. I have a big pet peeve with star fruit, although I love it. But star fruit is one of those fruits that is very high in oxalic acid. And we know that oxalic acid is one of those acids that is metabolized through the kidney. And depending on your hydration status and depending on the level of your kidney impairment, oxalic acid is an acid that may not be readily excreted through your urine, and it can build up in the blood, can build up in the urine and predispose you to kidney stones. And that is a real phenomenon that I have dealt with patients causing kidney stone formation. So there are certain foods that are high in oxalic acid, kale, star fruit. There are also certain foods that are high in purines that can cause gout, which is a buildup of uric acid in the blood. Anything else you wanted to add, Dr. Reed?
No, that's pretty much it. That's actually what I was going to say, actually.
Okay, great. Great. All right. I don't see any further questions in the chat. And it's 7:00. And I just want to give a big round of applause to Dr. Reed for really showing us, taking us from the introduction of lupus, how it affects the kidney, and tying it in so nicely with our theme this year of the kidney health and protecting the planet and your environment. So thank you so much, Dr. Reed, for your presentation. And we wish you all the best in pursuing your further studies to become a nephrologist.
Right, thank you very much. And thanks
You're
for having
you're so welcome. So at this time, I am going to hand over to Anishka, our board member, to do the closing remarks.
Okay, thank you so much. Dr. Lowe Jones, and thank you so much, Dr. Reed. It was definitely a very informative session. And so as we are wrapping up this evening's proceedings of Ask the Expert, which by the way, it's a quarterly session. So I hope you look out for the next post that is made at the end of, what's the next month in the next quarter? Is it June? That'll be June, right? April, May, June. Yes. So you can look out. I see that a lot of persons tune in. So we hope that you learned a lot and you are looking forward to the next session in June. So a huge thank you once again to Dr. Tanya Reed for the insight and the knowledge that she shared with us. It was truly an informative session. And for everyone that is present and engaged, we also thank you for your time. This evening was a powerful reminder that lupus nephritis is a serious condition, but with us taking control of our lifestyle and taking action and ensuring that we have the right support around us, as well as something as simple as also, sharing what is going on with you, with your doctor, so that they can also better be able to care for you, so that you can manage your symptoms properly, right? So it's very important. So whatever it is that you took away from this evening, from what Dr. Reed shared, as well as some of the pointers from what Dr. Lojo shared. I just hope that you can continue to care for each other, check in with somebody, and you may have even also learned a fact tonight that you could share with somebody else, right? Because even the smallest act of awareness can save somebody's life. All right, and I just also want to take the opportunity to remind you that the Lupus Foundation of Jamaica is also here, right? So feel free to get connected. I've shared in the chat the number as well as our social media, because World Lupus Day is also coming up, and um we'll be sharing on the social media pages facts about lupus. So you can, if as I said, if you're not a patient, you can also tune in, look out for those facts. Maybe there are some symptoms that you are experiencing and you can probably speak with your doctor about it. Also, you can visit our website, um, and just stay tuned to just get connected with us. Remember to, most importantly, save the WhatsApp number. You can WhatsApp us, you can call us, but stay tuned to our social media for World Lupus Day. It's May 10th, by the way. I know that we'll be sharing it with Mother's Day, but we're hoping that everyone will still, take an opportunity to just spread some awareness, because community awareness is very, very important. Dr. Lou Jones, are you, are you taking? Okay, so we see that we're getting some questions on YouTube. So for the persons who are watching on YouTube, we will take your questions and share them with Dr. Reed, and then we will get those responses back to you. So please to leave your name and a contact number if you like, and we will share your questions with Dr. Reed and get back to you. But thank you once again for joining Ask the Expert, and we'll see you again in June. Good night, everyone.
Good night, everyone.